As more and more awareness spreads from this platform on Peyronie's disease, a very disabling and distressing disease of men on their male organ, which continues to deform and give them discomfort and obviously puts them down on the morale and a kind of suffering which is very undefined. It needs to be again informed that Peyronie's disease is a fibrous disorder which, through the fibrosis that develops around as a result of excessive amount of collagen being produced locally in that area, causes a kind of an unstretchable feeling which is called a plaque. So plaque is basically excessive collagen deposition which is inelastic, develops inadvertently for reasons unknown. There are some causal relations which may be identified. So when I look at Peyronie's disease and I look at the kind of Peyronie's disease clinic that we're running at Kokilabhen Hospital, where we are evaluating, treating, and taking them in a journey towards repair and cure, more and more Peyronie's disease individuals do come in from various parts of the world. Having seen patients from India, from all parts of India, and now coming from Asia Pacific region, it is important for us to take Peyronie's disease awareness, number one, and number two, its therapy and cure to the final levels, where a man comes out of this agony that he's living with. What normally happens is there could be umpteen kind of presentations which people come with. Some people come with a presentation where they have a discomfort or pain, which is in the erect penis or in a non-erect penis. So that could be one of the first symptoms in one subset of individuals who complain of pain and discomfort in the penis. They say, I've got pain when there is an erection. I've got pain when there is no erection. So it depends on individual to individual who is getting what kind of an issue. So that's something which is not uncommon presentation. And believe me, that's an acute presentation. Most of the people who present with pain in the penis is more recent presentation. It could be a few weeks to a few months, having heard me on the YouTube and having come in from different parts of the country, having attempted treatment with their andrologists and our colleagues on various therapies, which is not giving them relief. Their pain grows, their pain becomes disabling, they probably are not able to perform. The pain becomes worse on their best erection, or the pain is happening when they get up in the morning with an erection which is still intact. So presentation of Peyronie's disease with pain is more of an acute kind of phenomenon which many people present. The presentation is quite common. Over the last few weeks, which happens to be the first part of the January in 2023, I've seen close to around 11 to 12 patients who have come in from different parts of the country only with pain. That means their discomfort, their agony, their distress, and their entire aspect of going through this issue is related to pain in the penis, which is all the time, which has been there for quite some time, or a recent onset pain in the penis, which they are not able to define, which comes more with erection. They get up in the morning with pain when the erection is the best, or when they attempt to perform in the best of rigid erections, the pain becomes disabling. So pain as a presentation of Peyronie's disease is more of an acute presentation. If that is happening with you, I think it's time for us to meet me at the Kokilabhen Ambani Hospital in the Peyronie's disease clinic, where we look at erectile dysfunction and sexual dysfunction in a larger picture of it. This is a very niche domain that we're getting into. I said there is an excessive amount of collagen deposition happening as a result of that being produced locally, which is through an insult happening in that area where everything is elastic. Remember, a male organ is an elastic organ or a stretchable organ, stretches more to more amount of inflow of blood and therefore gives you that rigid erection that you're capable of. That stretch capability goes away missing in localized areas where the excessive Peyronie's disease plaques are forming, which are fibrotic kind of aspects and therefore a fibrotic disorder. So that fibrotic plaque, which is felt by you as a man during the palpation or feeling of the organ, can sometimes be felt in a non-erect penis, because in erect penis, everything is firm. The tunica and the bucks have stretched. And sometimes you in a non-specialized hands as an individual in the society or not being used to feeling such diseases may not be able to feel it. So people present that there is a palpable hardness, palpable small lump or a plaque or a button, the way they call it, is felt during softness in the shaft of penis where there has been some pain. That area and the surrounding areas do stretch during erection and they give pain. They also are becoming less and less elastic. So inelasticity brings about a deformity. As it gradually matures and as we take care of the acute component and stabilize it, we are in the journey of stabilizing it, of not letting it progress. And not letting it progress because the progression could bring about a incapability of stretching of the penis, which brings you an erection. So two changes could happen then. So one presentation could be a curvature or a bend. Penile curvature or penile bend is more towards a mature form of a disease. and more individuals come with a mature form of disease. They come in with attempted therapies. Unfortunately, many of them undergo injection therapy, which to me at this point in time has not been a great therapy. Injection of Kenacort, injection of steroids into the plaque and penis has not really changed the direction of the acute phase. It was thought initially that an injection directly into the plaque, which is an uh, excessive collagen that is developing into fibrosis, could have an alteration in the natural history if you probably inject it with Kenacort, and that does not happen. It does not happen. The long-term follow-ups of these patients, because I see that long-term 3 and 10 years kind of patient changes around. The injection has not improved them. They actually worsen my future technique and result, because the entire area undergoes hematoma, undergoes fibrosis, and add on fibrosis compared to the natural process of inelasticity developing in the tunica albuginea and Buck's fascia. That is important aspect. So a deformity developing as a result of incapability of undergoing that wonderful stretch circumferentially is happening in the areas of the plaque, and those plaques don't let you stretch. So if there's a plaque in that area that doesn't stretch completely compared to other areas which stretch well, and that kind of non-stretching brings about a deformity. Imagine there are plaques circumferential, it may develop an hourglass deformity. Some people complain there is a narrowing in one area or constriction of penis in one area in complete erection, where the other areas are very good. So there could be constriction here, and there could be an elongation or hardness here. So it looks quite deformed kind of thing. So basically, a penile deformity happening in the most mature years of your life, with or without your knowledge, which is making you incapable in the bed, incapable as a male, and probably taking away into a progression which is diving deep. You got to see a uroandrologist who's interested in it, who takes care of this. And at Peyronie's disease clinic at the Kokilabin Hospital in the Department of Urology, I think as a team of urologists, we go deep into it. I feel that we need to really go deep into understanding the disease, identifying who is at what stage, and taking them forward in a journey where we treat them, intervene their natural history, and repair them. So I was talking about a palpable plaque as a plaque. Shortening of the penis is another important deformity which happens. Many people start talking about that my penis is shrinking, nothing else, that they can just see this. So shrinkage of penis is another kind of a possibility that can happen. So if I look at this kind of presentations which men can have from the acute phase of discomfort, pain, agony, which has started recently, to some pain which has continued for a longer period of time, where the pain is not only an erection, but pain all the time, I think it's time to look into other aspects of care. And therefore, discomfort and pain in the acute part, continue to progress pain, which has been continued all the time, continue to an identification that this has gone wrong, where the angle and the curvatures have gone into a J shape, an S shape, a torque, a tilt. All that probably actually becomes quite an agony mentally. 24/7, you continue of looking for help and help and help. And finally, this is unfortunately hitting all ages in life. So people ask me, why does it happen? A localized fibrotic reaction most commonly can happen because of a trauma. A trauma or an injury does not happen in the penis, but a trauma of continued bent, continued irrational kind of self-motivated injuries which could happen around are commonest causes around. These are actually called as micro traumas, and these micro traumas cannot be. Somebody would say, I was masturbating since childhood and I got a trauma of that. Possible. Many of them are still undefined. The actual cause is undefined. Attempting to bring about some causal aspects to it. There are some medications like the beta blockers, which we use for hypertension, are known to cause a little bit of an extra amount of fibrotic reactions in tissues around. Some medicines which we have known about, like the anti-seizure medications, which phenytoin and certain other components, which bring about those changes with huge amount of vitamin C also. And these can actually bring about excessive amount of fibrotic reactions in locations around. So you can find some people have got fibrosis here, some people have got a plantar fibrosis, Dupuytren's contracture. These are also that kind of localized fibrotic reactions which can happen around. Friends, we're dealing with erectile dysfunction or sexual dysfunction of men. And sexual dysfunction of men in patients who could have Peyronie's disease could be actually be having a deformity. So a deformity or something which is happening in an area of the penis, which brings about a bend in the penis, is about a localized change which is happening around. And that change is not a good idea. That change has to be identified by us in time. There are some people who could have an hourglass deformity, a deformity where it is shrinking concentrically to an area which becomes a troublesome. So a fibrotic disorder of the tissue in that area where there's excessive collagen getting deposited, where some kind of a genetic predisposition, some kind of a trauma, and everything is not well in the penis of a young man is not acceptable. There are some very young men in their early 20s present and say that my penis, since has been remembering the curvature, is actually a curved penis. So they are congenital penile curvatures. I see men in their teens to men in their 20s who never had any trauma, never had any factors. They don't have any genetic predisposition. They are not one of them who are diabetics. Though I, in recent times, over the last few years, maybe close to a decade, have seen that diabetics have a little higher predisposition. Again, that could be related to tissue healing, handling, and that area itself undergoing umpteen changes of elasticity, of microtrauma, of drug-related reactions could actually lead to that. So Peyronie's disease is curable. We could cure that aspect of trouble. So what your trouble could be? Pain and discomfort, distress. You could have a deformity or a bend, which is an important aspect that you need to bring about a care. You could have a shortening of the penis, which happens. You could have a complete loss of erection or erectile dysfunction. And you could have indentations and hourglass curvatures and changes in the shape. So the plaque itself is treated, but the plaque always is not removed. Remember that. So plaque could be a part of your life. For example, if this part of the skin is involved with a white patch, then I don't remove the entire skin. I look at letting that area not bringing about a deformity to the dog. So understand that plaque is only an end result of a local reaction, which a doctor will take in your journey to straighten up your penis and keep it stable and straight and around. Peyronie's disease probably requires more information that we are able to impart to you. But in the information that we've imparted, we're able to bring about a cure to individuals who are going through a deformity and an agony whose direction is probably not known. Over years of injections, over years of oral therapy, patients have only progressed to a point in time from where recovery has not happened in many of them. So Peyronie's disease would require a penile prosthesis in a subset of patients who have also got erectile dysfunction along with a caudy or a bend. And the caudy or the bend, which is a medical terminology, has actually to be straightened up and a process is to be put in men who have no erection, compared to men who've got good erection, and those erectile patients who are capable enough need to be brought back to their capability as what is required. So friends, Peyronie's disease is treatable, it's curable. We need to identify the complexity of the curves that will happen, which are palpable plaques, which are palpable deformities, which are discomfort and distress, which are penile shortening, and finally an erectile dysfunction. It needs to be completely cured in one go. So more and more attempts to bring about this as a result of the changing epidemiology or changing awareness, I would say. As more and more men are getting aware, they identify that Peyronie's disease is completely treatable phenomenon. And we need to probably look into this Peyronie's disease aspect, a care that we need to bring to them. Thank you so much.